Excuse me.
Three, two, one.
Good morning and welcome to Opening Doors. I'm your host, Warren Wortham, the manager for the Martin Luther King Jr. Center of Hawkeye Community College. We have a great show lined up for you this morning, but before we get into the show, I do want to mention some opportunities that we have at the Martin Luther King Jr. Center. First of all, we have nurse aid courses. So for those of you who are looking at getting your first experience in the health sciences field, you can try out with Certified Nurses Aid, and you can give us a call at 319-296-4440 for more information. Along with that, we also offer rehabilitation aid classes as well. So again, you can contact us at 319-296-4440 for more information. Also, we offer concurrent enrollment for high school students that are looking at obtaining free college credit while you're attending high school. So if you're a high school student or the parent of a high school student, please talk to your high school counselor and you can get more information about concurrent enrollment. We also offer the Compass test for those of you who need to take the Compass test. So if you want to get scheduled for the Compass test, give us a call at 319-296-4440 and hit extension 2 for Ms. LaTanya Graves, and she can get you scheduled for Compass testing. Along with Compass testing, we also offer the Compass Preparatory Academic Lab, that's a tongue twister, and basically that is a free tutoring program that goes alongside the Compass test. So for those of you who have taken a Compass test and want to improve your scores, or if you want some brush up before taking the Compass test, you can try the free tutoring program, which is called the Preparatory Academic Lab. We also have partnered with the Waterloo Public Library to offer access to the Learning Express database, and that is a great resource if you're looking at things such as practice tests for ACTs, SATs, practice tests for some of the nursing exams. Pretty much if it's something that you're looking to access for practice testing or for additional information that's not offered readily anywhere else, you can utilize the Learning Express database. Well, in the studio with us this morning, we have Ms. Jennifer Holscher, the Health Continuing Education Coordinator for Hawkeye Community College. Good morning, Jennifer.
Good morning.
Well, first of all, I want to thank you for being my guest this morning.
Thank you for having me here, Warren.
Great. So I know you offer a lot of programming in your areas, but before we jump into that, can you tell us a little bit about what you do for the college?
Okay. Well, I'm with the division of the college that focuses on providing ongoing education for individuals that are either already in a health profession and they come back to the college to go further in their career path, or perhaps you're somebody that has a certification that you need to keep active, a license that you keep active. We have continuing education classes. And then we also have career programs, short-term, non-credit programs that are for individuals that are interested in getting into a health-related career without going through a 2-year degree program.
Oh, that is fantastic. So you mentioned if you have a certain license that you need to renew or update, you offer that in your area?
We do. We will have, so for example, you may be a nurse or a mental health professional, an occupational therapy or other therapy professional. We do schedule classes for licensure renewals.
That is fantastic, because we get calls about that every week wondering if there's the opportunity available anywhere to do that. So now I know exactly where to refer them. Great. So can you tell us a little bit about some of the programs that you brought us here with the listeners today?
All right. Well, I am excited. We have one brand new program that's going to be starting on April 20th. This is a short-term career program, non-credit. So this means that you don't have to apply for admission to the college. This is called Medical Billing and Coding. It is a great career opportunity This is a job where you would find yourself working in a medical office setting. It may be in a physician's office, it could be in a dentist, chiropractor, or in a setting such as a hospital or outpatient clinic. And what you would be trained to do is how to file insurance claims and how to code procedures and other types of medical care that is provided to the patient when they come in to whatever setting you're working. This is a very important role in healthcare because this is the person that translates what care is provided to the patient and translates that on the bill so that proper payment is received by the physician or hospital or clinic that's providing the care. The course will last for approximately 3 months. It starts, like I said, April 20th. It's 2 evenings a week, so we hope that that makes it readily available for people to work into their schedules, and it will be concluded by the end of July.
Fantastic. And that is a program that a lot of people have asked about in the past, and that, again, recently, the requests for it have come about at our center quite a bit. So now we know that we can tell them there is a program that will be starting soon. What's the registration process?
The process is to call our Cedar Falls education registration number. They'd be able to call 296-4290. A little bit more about this class would be that the United States Division of Labor has an Iowa Workforce Development. They do studies on what careers are in the most demand, and there is an anticipated growth. I was reading on the Bureau of Labor Statistics an estimated growth of 22% in this field. In Iowa, considering the cost of living here in Iowa, they estimate that individuals would start at a salary between $25,500 to $34,500 a year. It's a job that someone can go into, like I say, 3 months worth of training. Our course is being taught by Laura Rogers, is her name. She is a certified coding specialist that works at Wheaton, and she has over 20 years of experience in this profession. So she's an outstanding professor or instructor who we're lucky to have. Upon finishing this class at Hawkeye, the individual, the student, is going to be able to take a certification exam, which is important, to distinguish yourself as having the knowledge that you've gone to the training for. That exam, we are including in the course a day-long exam preparation day. So we're going to work really hard at making sure everybody that attends this class is a success with that certification exam so that they'll be able to be employable right away.
That's great. And, you mentioned those starting salaries. For that little bit of time that you have to commit into obtaining that skill, you really can't beat that.
Yeah, it's really a great opportunity, and this is a job where, because it's an office setting, even individuals that may have worked in other types of work that maybe was more physically demanding and they're needing to find a change.
Yes.
This is a great opportunity. People maybe who were nurses or nurses' aides that find that they need to go into something a little less demanding on their bodies, this is a great opportunity. We also know that this is a job that can be done from home. Medical billing and coding, I wouldn't recommend it at the beginning. You probably need to have a team around you when you're new.
Yes.
But maybe after you got a year of experience under your belt, it would be something that potentially could offer you the opportunity to work from a home office.
Wow, that's incredible. And we're starting to see more and more careers kind of move in that direction where, you can do them on site or from home or remotely. And I mean, yeah, that's just fantastic. I'm always amazed at the opportunities that are offered by Hawkeye Community College. And so every show I like to mention that Hawkeye Community College has a way of gauging and assessing community needs and then finding programming to meet those needs or building it from the ground up. So would you agree that this kind of fits that same kind of
Yeah, because since I've been at the college, which has only been since September, I have had many calls on this course. Now, Hawkeye Community College does offer a 2-year associate's degree in medical billing and coding. So if if that was something that was important, to you, getting an associate's degree, it can certainly be done that way. But if you're a person that needs to get out into the workforce right away,
Right.
this allows you to do that. I think you could continue to work towards your AA
Yes.
if you wanted to take those other elective courses, but this is going to teach you the nuts and bolts of what you need to get a job right away.
That's fantastic. And, you know, when we had the, you know, as a nation, when we experienced the, you know, economic crisis, that's what made the programming at Hawkeye so valuable, because, you know, you had people who had been in the field for so many years, all of a sudden jobs gone, and, you know, they have bills to pay, so they could come to Hawkeye, choose from, oh man, I don't even know how many different programs, get in, get out, start making money, get back stabilized, and then they could come back and build on those skills that they obtained. So I think this is another one of those great opportunities. And again, it's something that for years people would come in and say, you know, do you have a medical billing and coding program available that I could get into? And it was kind of a surprise to me. I didn't really understand what they were asking for. And so now this makes perfect sense. So
Yeah.
your prayers and requests have been answered. Now, what is the cost for this program?
Yeah, that's the next thing I was thinking. You know, we always hold our breath and wonder what the cost is going to be. The cost of this course is $2,199. It includes 6 textbooks, which are actually the reference books that the person would use once they've started their job, because these coding manuals are, you know, they're the tool that a person just lives by when they're in this job. The course is over 80 hours long. We include the day-long exam preparation day. This course, of course, is a lot of money. We can divide it up into 12 payments at no extra cost if you wanted to do a payment program. There is also tuition assistance available through Iowa Workforce Development. If you qualify, that's a program called PACE. And I would have to defer. I'm not going to be the person to be able to answer to all of those qualifications. But if you were interested in this program, it would be very simple. I'll actually give you the phone number right now that you would call at Iowa Workforce Development to get information on the funding assistance. And that number is 296-4247.
And then any particular person to ask for?
No, they have, there's 3 different counselors that answer, or that check that you likely will leave a message, and then one of the 3 counselors that work with PACE and GAP would call you back and discuss. It's things like, you know, your previous work experience, because the programs through Iowa Workforce that are providing financial assistance are for individuals that are considered to be underemployed in some way.
Okay.
And then also there's a certain criteria for what your household income is, but I know that's really quite generous. I've
Yes.
seen it, and I feel that it's something that's, people wouldn't want to rule themselves out until they talk to somebody
Right.
about it.
And I'm agreeing with that, because I know if it works anything like the GAP tuition program, again, the income guidelines are very generous.
Yeah, so it's exciting to know that there really are there are supports out there for people to be able to get this done. And I know even the payment plan can help. We've set that up for a couple of people already.
Great. Now, are there any prerequisites to getting into this program?
There are no prerequisites. I mean, we would want you to know that, you know, for one thing, you know, when we talk about it being in an office setting, you know, you'd have to be comfortable with being at a desk and working with a computer, you know, so having some basic computer skills is going to be important with this class. Being able to read, you know, some complex, you know, language, because it's going to, part of the course is going to teach you medical terminology. But what a person does in this job is you are given medical records from patients' care that they received. You read that, and then you assign codes to what was provided. So it just does require a certain ability to be able to, you know, learn some new terms and
Yes.
to do some interpretation. But we don't have any prerequisites. Anyone that's interested and wants to, you know, try this profession is welcome to join the class.
That's great. And, probably being able to comprehend it pretty decently then too, what you're reading would probably be something you need to. And, that may sound a little daunting, but it's not. Believe me, once you brush up, on things that you haven't maybe used extensively in years, it comes back to you super fast.
And it's forms, these are forms. You yourself aren't going to have to be using a lot of writing.
Right.
There's forms that you're going to be filling out. Actually, the forms probably are computer generated with the patient's name, their insurance
Yes.
information, the physician name, and what you're filling in are these codes, combinations of numbers and letters that the
Yes.
people at the insurance companies say, oh, okay, then we pay this much for that and this amount for that procedure, and that's the way it works in a nutshell.
Now, a person going through this will, their training here in Iowa be transferable anywhere else in the U.S.?
Yeah, the exam that you take is a national exam.
Oh, great.
And so, that allows you to work in other states, and especially if, after you had enough experience, you wanted to work from a home office, you could seek jobs from companies that aren't even in Iowa.
That is fantastic.
They could scan and send you the records if you had, you'd have to have a good computer set up in your home to be able to do that. But it would be possible for you to be at your home office and work for a company anywhere in the United States.
That's incredibly awesome.
Isn't it neat? Yeah, it is really, really exciting. So that's why I'm really hopeful. This is the first time that we're running this program here at Hawkeye, and I know it takes time to get the word out, so I'm really hoping this is going to be catching on. We have the spring class through July,
Yes.
and then I'll be scheduling it again to run in the fall and again next spring. So if this is a little short notice for you to be ready to do it, know that we'll have it again in the fall.
Fantastic. And then, where will the classes actually be held at?
They're going to be at our Cedar Falls Center. So the address for Cedar Falls Center is 5330 Nordic Drive in Cedar Falls, which is located in the Cedar Falls Industrial Park. So there's real easy access from Highway 20. You would take the Highway 58 exit, and people know landmarks such as the Casey's General Store that's on the corner and A&W. We're just down the street from that.
Great. And then do you have any other programs that are coming up?
Well, I have, you happened to mention the rehabilitation aid class. One of the things that I do is I coordinate programs that are designed to advance nurses' aides
Yes.
into other aspects of the profession. So rehabilitation aid is one of those courses. If you've worked as a CNA for 6 months and you have a desire to work, what ends up happening in this situation is you are working in a skilled nursing facility and you have residents that come to your facility for their rehabilitation after they've had a stroke or they've had a fracture, and they have therapists in those facilities, physical therapists, occupational therapists, and they write exercise programs, or they will write, and the rehab aide is the person that on a daily basis implements that program with the patient.
Okay.
So it's somebody who, somebody who can be motivational to somebody to work hard. You get to see the rewards of somebody improving, making progress, getting better. So it's a great program. We start that on Friday, this coming Friday, in the Martin Luther King Center.
Yes.
It is taught by a combination of an RN, an occupational therapist, and a speech therapist. So you get to learn a wide range of the background, the medical background, to understand what has happened to the individual, and then to understand the different type of therapy interventions that are implemented to help a person make progress and achieve their goals.
And then, as with the other program, a person that goes through the rehab aid, the prerequisite would be first 6 months experience as a CNA.
Yes.
And then will the skills be transferable across the US or?
That would probably be more limited to Iowa.
Okay.
I would have to do research on that. If you went into another state, other states have programs, but you may need to take an exam if you went into another state to show that you knew the content of what you knew matched what another state expected.
So now, a nurse aide that goes through this program, would they see an increase in their pay?
Yeah, they will see an increase in their pay. I don't know to what extent, but it's considered a promotion to go from being a nurse's aide to a rehabilitation aide. It changes your daily work.
Right.
Daily work for a nurse aide is typically, bathing, dressing, getting to meals, getting to activities. A rehab aide is going to be solely focused on implementing these programs, these therapy programs. So you have a calendar each day of the people and what they're, how far one person needs to walk, how many leg raises another person needs to do. You may do exercise groups if there's a group of people that are working together on some of the same goals. But and then there's a lot of documentation. There's documentation on what you, each day when you do the program with a person, how do they do? In what ways did they do well, and what ways are they still demonstrating challenges?
Okay. And then I know you have another program that you're looking at launching.
Yes, we do. That is called Prepare to Care. Yes, this is a brand new program for Hawkeye Community College, and it's a brand new program in Iowa. And this is probably, I could go for a whole nother show on this, but briefly, what Iowa is doing is they're redefining individuals that provide care as direct care professionals, and that's a term that encompasses nurse aides, might be called a universal worker, a resident assistant. So individuals that are direct care professionals have only in the past had the traditional nurse aide training to become certified. But nurse aide training is designed only for people that work in nursing homes.
Right.
Prepare to Care is going to provide certifications to individuals that work in settings such as group homes, independent supported living, day programs, respite care programs. It's going to be much more broad in terms of the settings, and it includes hospitals, and it will provide certifications to those individuals so that it's known. This person has completed these competencies, and it's known to agencies. If you change jobs, it would say that you didn't need to be retrained because they know you have completed courses X, Y, and Z. So it's exciting to me as a representative of the college, as a healthcare, as a nurse, because I know there are a lot of individuals that work in assisted livings and supporting people that are living in their own homes, that there isn't really a credential for that. And now we're going to see that come.
Okay. Now, so again, this is the first in the nation, or just?
It's, what actually, interestingly, Warren, this is a federal grant that was awarded to Iowa and a few other states in the country probably nearly 10 years ago to design this program to provide better training, more consistent training to direct care professionals that at the time didn't have any standardized training. This is a profession that is growing very fast. In Iowa, direct care professionals are the largest single group, largest single profession in Iowa, and it's growing. And the concern in Iowa is that we don't have enough people filling positions to keep up with demand. People are aging in Iowa, and also people with chronic disabilities are living much longer because of good medical care. So we need more direct care workers. This Prepare to Care program is going to provide individuals with the training they need to get jobs and to be successful in them. And we will be starting our first pilot of the course in this summer term in June. It's going to be a limited enrollment because it's our opportunity to launch it while studying it, and then I plan to implement the program fully in the fall.
And where's your test site gonna be?
Well, our test site is going to be at the Martin Luther King Center,
Yay.
two nights a week. Yes.
And you know, that's a really fantastic opportunity to be a part of something new that's gonna be rolled out, you know, eventually everywhere. So listeners, this is something, and like Jennifer said, it's gonna be a growing opportunity. So, I mean, jump on this right now. Strike while the iron is hot.
Yeah, this is great because right now, we talk about the nurse aid program all the time, which is great, but now there's another program that say you want to work in the care of individuals, but maybe a nursing facility isn't for you. Maybe you want to work with younger people in a group home setting. That's what Prepare to Care is for. Not that you could work in a nursing home with Prepare to Care too. People will have a choice as to the training they take.
Fantastic. What's the cost for this program?
That is to be determined yet. We
Okay.
haven't gotten that far on estimating the costs, but there will be tuition assistance available for this program through PACE and GAP as well.
Fantastic. So, as this program gets closer to launching, will there be any community info sessions or anything?
Yeah, you know what, that's one of the question is how do you get the word out? How do you let people know about this? Right now, what we've been doing is we started meeting with healthcare organizations in December, and we have been having regular meetings where we invite representatives of area hospitals and group home facilities and support and employment agencies to come, and we've been discussing all of the details of this program and how it will benefit them. Next, what I need to do is get to the people, the students, the people that are interested in the career path. So I will make plans for that.
Great. So when you get to that point, will you come back on our show again?
I'd love, we could devote a show to Prepare to Care.
Fantastic. Well, we're coming up on like the last maybe 40 seconds of the show. So with that being said, I want to give you an opportunity to share anything else you think the listeners might need to know or even contact information.
You can contact me directly. My name again is Jennifer Holscher, and my direct number is 296-2320, and then it's extension 3017, and I'd be glad to discuss. Everybody has a unique situation, and I'd be glad to talk with you about what yours is and help you find the right program for you.
Great. Well, I want to thank you for being my guest this morning.
Thank you so much, Warren. I'm glad to be here.
And we look forward to having you back with some more information on that Prepare to Care program. It's great to, you know, have the MLK Center actually be one of the, you know, pilot sites for it. So, with that being said, listeners, you heard it here first. Take advantage of these opportunities. And until next time, enjoy the rest of your day. You have been listening to Opening Doors. Thank you.
Great.
I noticed, I had it on silent. I didn't know it was on. First time I ever used the timer on it.
We are having, you know, your building, I was